Make sure they're there. All right. And we're on, guys. Introduce yourself and tell you what...
This one. Stand over there.
Oh, he's going to change the...
Okay, all right. Making sure we're all three in it.
Talk.
Hello, my name is Cadet Conrad Carroll. This is Cadet Dean, and this is Cadet Jackson. And our presentation is on first aid. Now, when you see this symbol right here...
What chapter, what lesson?
We are doing chapter
3, lesson 3, first aid.
Got it.
When you see this symbol here, what comes to mind?
First aid.
First aid, yes, but it's something more than that. What else comes to mind?
Red Cross.
Red Cross, exactly. Red Cross, Salvation Army, all that stuff. So it's more than just first aid, it's taking care of others that matters most. Such as you like in the last 2 lessons, you learned how to take care of yourself and take care of your body. In this lesson, you learned how to take care of others as well as how to take care of yourself. We will be discussing carries, the Heimlich Maneuver, CPR, and burns, as well as overviewing it.
All right, but first of all, who knows what first aid actually stands for and what is it?
I could give you the book definition, but
Yes.
Well,
give us the book
yeah.
definition.
What does it mean to you when you hear first aid? Like, what do you
you're
think
the
it
first
means?
one definitely. Somebody. That's
Let me give you the book definition from... first aid is the immediate temporary care given to an injured or ill person until he or she can get professional help. So first aid is helping others while you're in the field, out on the playground, even if you're just in your backyard, your friend breaks his arm, your buddy gets bit by a snake or by a spider or anything like that, and you have to know what to do, how to fix it, and how to temporarily keep them from dying.
And one thing you need to always do is be prepared. If you're going to be away from a civilization, like you're going camping, going on a hike, always be sure to carry a first aid kit. It doesn't have to be all that big and all that, but just make sure you have a first aid kit, have supplies in case something goes wrong, because otherwise you'll be a lot less able to treat stuff if you don't have anything.
Some pertinent first aid supplies, such as instruments, are tweezers, scissors, anything to maybe cut the skin open or pull out a thorn or something like that. Yes. Equipment is like thermometers, cotton swabs, blankets, cold pads, that sort of thing. Medications, antiseptic ointment, some type of ibuprofen.
And usually if you go to a place like a CVS or a Walgreens, you can usually buy a ready first aid kit.
Usually ready first aid
it'll
kit.
come usually in a red bag that will just have all the supplies needed.
2 main things that I have found that is extremely helpful in any first aid kit is gauze, tape, and gloves. You're always going to need gloves, especially if your friend's got a 30-inch open wound and it's bleeding and it's got some sort of dark thing coagulating inside of it. You don't want to touch that with your hands.
Yeah, that brings up the universal precautions, where no matter what the injury, no matter who has the injury, you always need to follow the universal precautions, which are not to get blood on your hands themselves, unless you absolutely can't help it, because you don't know what that person has, what diseases they may or may not have. And you don't know what you have that may contaminate them as well. So you just need to always make sure to be careful with blood and any bodily fluids.
Explain the first aid, first steps.
All right, so with
you.
Oh, okay.
The first steps that you need to take in an emergency situation vary because every emergency situation is unique. But there are 4 main steps you should take in most any emergency. They go as follows. Recognize the signs of an emergency, decide to act, call for help, and provide care until help arrives.
Now, going a little more into each of those, recognizing the signs of an emergency, it's not too difficult to tell, but at the same time, you have to keep a weather eye, even if you're just walking down the street and you see a guy on his knees and it looks like he's coughing or he looks to be in some help. Go and ask him, "Hey, are you okay?" He could be crying because his girlfriend just broke up with him, or because someone just stabbed him in the rib cage and he's bleeding out. One or the other. It looks the exact same from far away, from behind. I'm telling you. And then decide to act. You can't be unsure. Like, in that sort of situation, you can't be like, hey, you okay, buddy? You okay? Go get your Band-Aid. It's going to really You have to put your all into it. You have to be 100% into helping him. You can't be 30 or 40 or 50. You have to fully dedicate your time to him, going out of your way to help him out.
You also need to know when to act, because not all situations require you to act. Like, maybe someone's hurt, but someone's already taken care of them. That doesn't mean that you need to go over and help them, because they're already being helped. You should instead focus on calling for help instead, because too many people trying to help one person will actually do the opposite and be bad for them.
And the third step, call for help. A major summary of that is 911. If you have access to a phone, try and call 911, or you can call the operator for help if any case 911 does not work, to get in contact with the hospital or police. But it says when you call, you need to stay calm and be sure that you know everything about what's happening, so you can give the person you're talking to a very accurate report of what's going on, so they know what to expect, what they need to bring, and who they need to bring.
And one thing you should always do when you call 911 for help is the first thing you should do is state your location. So that way, the moment they have the location and they know something's wrong, that's when they send someone out. They can't send anyone to help you until they know your location. So, like, if someone gets hurt at the school and it's a weekend, you should call 911, tell them, I'm at Prescott High School, give them the street address, and then explain what happened. So that way an ambulance, police car, whatever, can already be on its way by the time you're done explaining.
And then another thing is, well, the final and last step is provide care until help arrives. So you've called the police, you've made sure you and the victim is safe from any further harm, and you've decided to help this person. The fourth step is making sure you can help them. I know you're probably not going to have a first aid kit. You're not going to have an entire hospital in your back pocket. I don't know anybody who does.
I do.
But helping them, even if it's just running across the street and grabbing a few napkins from a restaurant and pushing it onto the wound or something like that. Or making sure they're breathing deeply. Making sure they're staying safe. Sprains, okay.
Yeah, so for sprains, usually happen, are most common are you fall, sprain your wrist, or you twist your ankle on a rock or something like that. Those you treat similar to a fracture, but not quite as severe. You just have them not put weight on it, like if it's their ankle, kind of help support them so they don't put weight on their foot. And then for the wrist, try to keep it still and put some ice on them maybe until you can get a brace.
The thing you can do for any type of sprain is use the RICE method, which RICE stands for rest, ice, compression, and elevation. Rest, it suggests you rest the affected joint for 24 to 48 hours. Ice, apply ice to reduce swelling and pain. Compression, compress the injured part by wrapping it in an elastic bandage. And elevation, elevate or raise the injured part above the level of the heart to reduce swelling.
Alright, and then for fractures is basically a broken bone of any kind. It can be a crack to the bone was sticking out of his arm.
There are two different kinds of fractures,
Yeah,
open and closed fractures.
Either way, it's still a broken bone and they should still be treated accordingly. And for these, you want to make sure the body part that's broken does not just flop around. You want to make sure it's still and set so they don't damage it further.
The fractures are a very good time to use splints.
Moving on past fractures and sprains, insect bites and stings. Now, say you've got a splinter in your finger. The area around it, it's red, it's angry, it looks puffy, and you're just like, ow, there's a splinter in there. Now, you could see someone else have the exact same wound, maybe a little red and a little more glistening, and you'll say, oh yeah, he's got a thorn, right? You touch it and it pops and blood starts welling out of it, and you're like, what's happened? He's either been bit by a spider or stung by a scorpion, or any sorts of things. Now, it depends from insect, because I've heard from many people that if some snakes bite you, you're done. There's no saving you, even if they get you and get an anti-venom into you within 6 seconds of the bite. There's no way you're going to come back. Then again, I've heard of some snake bites that take weeks and weeks and weeks to take effect and just slowly attack you. So if you feel as if, if you hear a friend say, oh man, I've been really tired lately and I've got this itching thing on my arm, either tell him to have it looked at or make him go get it looked at. How to remove a tick. Now, I'm sure you've all seen a tick or seen something that is tiny as a tick, a little black thing. It's not. Ticks are very interesting things. They have. Let me show you a picture right here. It's in your book. They have pincers that sink inside of your skin and literally latch on, which is why when you pull one off, when you smack it off, you bleed because you literally ripped off a piece of its skin, a piece of your skin along with it. The best way to remove a tick is by taking a pair of tweezers, that would be the best choice, a pair of tweezers, grabbing it by its thorax or by its head, just closest to your skin.
Yeah, as closest to your skin.
Closest to your skin, and
Pull
slowly pull straight out.
Don't twist or jerk or pull at an angle because that'll rip its head off.
And
it will stay in your body.
And its pincers will stay inside it.
Either way, you don't want that. It will make the wound a lot worse and could infect it and get you a lot sicker. And then after you pull it out, you want to make sure to clean the area with disinfectant. And if you don't have any disinfectant, soap and water will work until you do get disinfectant.
Next, we're going to talk about burns. And there are varying levels of burns, varying stages, degrees, as it is. There's a first-degree burn, which is,
It's kind of like you're cooking and you touch the hot pan. That's a first-degree burn. It only affects
there may be a little swelling.
For the girls, the pearl and
It
iron.
only affects the very top of the skin.
It affects the top layers of the skin, and usually they're not too severe. You can treat just with some ice or running cool water over it, and then just letting it go away on its own.
And then a second-degree burn actually burns through the first layer of skin and the first and second layer of the skin. A little more serious, but at the same time not life-threatening. Can be taken care of by
two different ways depending on its size.
Cool the burn with running water, ice, compress it.
If it's within 2 to 3 inches in size, then you can treat it just like a first-degree burn with running water and some ice, and then just let it go away on its own. But if it's more than that, you should treat it like a third-degree burn and get medical help immediately. Otherwise, it's a lot more severe.
One more comment.
Moving on to third. Okay, go ahead.
Sunburns, they are normally classified as first-degree burns, but serious sunburns can occasionally be classified as second-degree burns. I do not know of any sunburns that can be classified as
Third-degree burns are the mother of all burns. They literally burn through your skin, your fat, your muscle, your bone, such as, I know this is probably unheard of, napalm. Napalm or hot lead, or even lava in some cases. Have any of you heard of Kilauea out by Hawaii? There's a shield volcano out there which seeps magma. There have been cases of little flecks of lava flying out and landing on a person's arm and literally burning through their skin, their muscle, their fat, their bone, and having a straight hole throughout their entire arm. If you have been burned through your skin, your muscle, your layer, your fat, your bone, go to the hospital. No, I'll be fine. I'll be fine. Put a Band-Aid on it.
You should not ignore third-degree burns or even really second-degree burns, because the area for third-degree burns is literally dead and can start decaying if it's not treated properly.
And one thing that can be a little confusing about third-degree burns, they will often burn through your nerves. So if you get a third-degree burn, you will often feel no pain. So you might not know it or might not think it's very serious.
Yeah.
But that if you don't feel any pain, you've been burned, and that's a big problem.
Next past that are foreign objects in the eye. Wash the eye out with cold water or running water. Nosebleeds.
And don't scratch your eye, though, if you have
Don't scratch your eye if that happens. Nosebleeds, take a napkin or a cloth, put it on your nose,
And
Put your head
apply
back.
pressure to the bridge of the nose.
Put your head back, make sure no more blood escapes. Fainting. Fainting and heat-related illnesses, they go hand in hand. Usually, 80% of what, say, high schoolers feel like, oh, I'm dizzy, or oh, my stomach hurts, or oh, I've got cramps, or anything like that can be related to water. Because, you know, you haven't had enough water, or you've had too much water, or you're dizzy, or you're exhausted, you're fainted. Drink some water. It's a cure-all, basically.
Yeah, but if you do see someone who fainted, don't try to pick them up, stand them on their feet. Just have them stay lying down and make sure they're still breathing, make sure their vital signs are all right. Loosen any clothing, like if they're wearing a button-up shirt and the top button's button, you might want to unbutton that top button. Just make sure they don't choke. And then if they don't regain consciousness in about a minute or so, you should probably start calling for help.
Moving
and
back,
then even performing CPR if need be.
Moving back a little bit, a sprain is a condition in which the ligaments that hold the joints in positions are stretched or torn. I want to give you these vocab definitions so you understand. Again, what is a sprain? Joseph Valencia.
It's when a ligament is stretched or torn.
That is a very cut term of it, but it'll be okay. A fracture is a break in a bone. Mr. Ryan McGee, what is a fracture?
Break in the bone.
Wrong! It's a break inside of a bone. Anyway, heat cramps. Can anyone tell me what heat cramps are? Silverton.
Painful involuntary muscle spasms that usually occur during heavy exercise in hot weather.
Thank you. And heat exhaustion. Mr. Ryan.
Is a condition characterized by faintness, nausea, rapid heartbeat, and hot, red, dry, or sweaty skin.
Heat cramps and heat exhaustion. Someone tell me if there's a common factor in there, a common word. Heat, yes. Those can both be cured so easily by either drinking water or putting ice packs on your head or even staying in the shade. Basically cool.
Yeah, don't just be in the sun, in like the really hot sun, for no reason. Otherwise you can get heat cramps or heat exhaustion or even heat stroke. So try to stay in the shade as much as you can, take rests, and drink plenty of water.
And then heat stroke is slightly different from heat exhaustion. It is not just a temporary, like faintness or nausea. It is
The most serious form of heat illness.
And
it
is
is
potentially life-threatening.
And the main sign of heat stroke is when your body temperature rises to over 104 degrees, which I do not believe is much higher than your normal temperature, but is still seriously life-threatening.
Moving on past that is CPR. Who can tell me what CPR stands for? Mr. Ashley Overton.
Cardiopulmonary resuscitation.
Thank you.
If we had a cookie, you'd get it.
There you go. Cardiopulmonary resuscitation. Yes. Now, does everybody know what the Heimlich Maneuver is? I'm going to demonstrate it right now on Mr. Jaron Bean. Permission to touch.
No.
Okay. Now, the way with the Heimlich Maneuver is you make a ball with your hand right here and you place it up beneath the sternum against the diaphragm. Usually the person is a little shorter than you. So now we're going to make it like this. No, I need this weakness. You push upwards onto the diaphragm, trying to expel anything that is inside of their throat. Trying to open their airway and such. 1, 2, 3, 4. And as you've seen in movies, then something comes flying out like a grape or like a piece
Lego.
of chicken nugget or something like that.
Although keep
a
in
Lego,
mind-
a brick.
Keep in
Rare
mind that
cases.
if you are really doing the Heimlich Maneuver, you will be doing it much harder than Steven did.
Yeah. Let me actually. If you do the Heimlich Maneuver right,
Quite a bit
if
harder.
you do that Heimlich Maneuver right, one of their sternum, one of their ribs will crack.
Not will crack, could crack.
Possibly. 90% chance. Okay, and shock. Can anyone tell me what shock is?
Yeah.
What a shock. Miss Ashley.
A life-threatening condition in which the circulatory system fails to deliver enough blood to vital tissues and organs.
Very good. You can tell if someone's in shock by their cold, clammy skin or their affluence towards things like, you don't have a leg on. They're just like, oh, that's bad.
Oh, do I? I didn't notice.
I didn't. Let's go get something to eat. You can tell if someone's in shock. You're just very confused by their actions, and so are they.
Yeah, and what you want to do to help treat them is have them lie down and basically not move. You need to keep them as still as possible and keep them warm. You know, if it's hot outside, just place them in the sun, but make sure they don't get too hot. And
get their legs and raise their feet above the heart. Try not to.
Yeah, and do not give them anything to drink. They could possibly choke on it.
If you have if they have a fracture like in the hips or anything, then it is actually advised you not lift their legs because that could worsen their condition.
Anyway, moving on. CPR is a first aid procedure that combines rescue breaths with chest compressions to restore breathing and circulation. As Ms. Ashley Overton said, stands for cardiopulmonary resuscitation.
And in your book, it's wrong. It says to do mouth to mouth, and that's actually wrong.
They changed that, yes.
Want to do that. All you want to do is make technically if they need CPR, and if they do, only do the heart pumps to get their blood flowing. Do not do mouth to mouth.
They came out with my stepfather, he is a firefighter. They have a mouth guard. I'm sure you can't find it in your common first aid kit, but that you put on the victim, and then you place your mouth over his. That is the only instance you would have to put your lips onto theirs, because I've heard of cases where someone gives another person mouth to mouth, and that person contracted mono.
Okay.
Very unfortunate.
No. You don't do mouth to mouth anymore with CPR. Okay, you just don't do it. This is an older book, and so the current guidance is no mouth to mouth.
Yes, sir.
Okay,
Yeah, that's what I said, not at all.
But I mean, so you were saying the only time you have to, there's no time. Okay, you don't need to.
Yes, sir.
Okay.
And try and make sure if they're conscious, make sure you get their permission to perform CPR, because if you try and do it right, like 99% chance you'll break their ribs.
Yeah.
Okay, and so far the vocab words have been first aid, sprains, fracture, heat cramps, heat exhaustion, heat stroke, abdominal thrust, shock, and CPR. Any questions? All right.
And something that can help in a situation that requires first aid is if you're in the forest, you're out hiking, camping, or something like that, and someone gets hurt, but they break their leg or something. You treat it, give them a splint, but they can't walk on their own, so you might have to carry them. And there's 3 types of carries you can do. One of them that only requires one person is called the fireman's carry. It's really simple and really easy, and it allows you to still have one hand in case you need to steady yourself, grab your gear, all that sort of stuff.
And then there is a second carry called the seat carry, I believe it's called, where you put one hand up here as such, basically put one of your hand on the other person's shoulder, your corresponding shoulder, and interlock wrists, so that someone can keep their body right here in case their pelvis is hurt, or their buttocks, or any part of their feet or legs, basically. And then there is the third and final one where you take your hand, put it on your forearm, and then you take your other hand and put it on their forearm, and then take yours and put it on your forearm. This supports basically almost any carry. The only problem with this is that the person that you're carrying has to put their arms around your shoulder.
For the 2-person carry, which is what he just explained, the person you're carrying must be conscious, otherwise they'll just keep falling.
That's what the fireman carry is for unconscious,
and
the
conscious.
2 carries we showed are for the conscious and helping, the type where they can.
Here, I'll demonstrate the fireman's carry.
No,
Permission
to do that.
We're not?
It's okay.
We got 3 minutes. Okay.
Sir, are we allowed to demonstrate the fireman's carry?
No, we got 3 minutes. I'll finish time.
Alright, so for you, for first aid, you must always be prepared. Don't overreact, don't flip out, stay calm. Make sure they actually need your help, otherwise you might do more harm. And then just make sure you treat each injury properly. So,
Just in case you've seen that picture, keep calm. and provide first aid.
And make sure you know how to perform first aid or get someone who does know.
Exactly. Make sure you call for help. And that's all. Thank you very much.
All right, everybody, round of applause.